Hello everyone and welcome back to Youthful Medicine. I am Dr. Tahir. Today I would like to talk to you about an important topic which I think is going to be huge in the coming years, which is the use of GLP medications and GIP medications like Mounjaro, Wegovy, and Zepbound or Ozempic. All these medications that have been used for weight loss, they're going to change a lot of many other things in our lives. And I will tell you that it will also be used for longevity and anti-aging. In the coming trials, they're going to utilize this. So if you want to live longer and a healthier life, stick around and I'm going to explain to you how these medications are going to change the impact of their health, the user's health, not only for weight loss, but in many other things. So let's start talking about the mechanism of action of these drugs on longevity. GLP-1 and GIP medications influence multiple pathways that enhance longevity, including cardiovascular health, weight management, of course we know that, inflammation reductions, which I love that because I always see the C-reactive protein going down, and neuroprotection. So you got your heart covered, your heart health, you got your weight covered, you got your inflammation covered, you got your brain covered. Here are these mechanisms and how they work. Cardiovascular health. Improved endothelial function. The GLP-1 medication enhanced the endothelial function, which is the blood vessels, the cells that line the blood vessels. They improve their function, reducing the vascular stiffness. So your blood vessels are not rigid. They don't cause increased blood pressure. They're more elastic and they can change dynamically with time and age. And it lowers the risk of atherosclerosis in that. So you got that blood vessel benefit there. Plus, reduced inflammation. Who would want more reduction in their inflammation? Chronic low-grade inflammation is associated with cardiovascular disease and aging. That's why, as a rheumatologist, I also see patients who have high inflammation in the blood and they lead to increased risk of heart attack. And these medications also reduce systemic inflammation, as evidenced by the reduced CRP levels that I see in almost every patient of mine. I check their high sensitivity C-reactive protein. This marker is highly sensitive for cardiovascular health as well. They improve lipid profile. You know, many of my patients, I am not even starting the statins medications that I used to, because when I give them these medications, their cholesterol level goes down, their eating habits improve. Of course, they have to put in their part into improving their health, but that makes a huge difference. So the LDL cholesterol goes down, triglycerides go down, HDL goes up. So that's cardiovascular health covered, which impacts your longevity. Your cardiovascular health is good, you're gonna live longer. Now let's talk about neuroprotective and cognitive health benefits. There's emerging evidence that GLP-1 medications have neuroprotective effect, such as diseases like Alzheimer's and Parkinson's disease. They're associated with insulin resistance in the brain. And if we reduce the insulin resistance, we will improve your brain function. So GLP receptor agonists are thought to improve the insulin resistance, reduce the neuroinflammation, the inflammation that happens in your brain, and enhance cognitive function. If we have cognitive function going on, we have reduction in Alzheimer's, the quality of life will so much improve. There's millions of people who actually are below the threshold of to be so-called Alzheimer's patients, but they have memory decline that reduces their quality of life. They can't go out, they can't work out, they can't take care of your health, they can't emotionally and connected to people, and that leads to reduction in their life and the quality of life, of course. So early research suggests that GLP-1 medications may reduce the neurodegenerative diseases. And on a large scale trials, they're trying to confirm this, and it would be coming up in next few years. So impact on GLP and GIP agonist on the key factors of aging process include: number one, reduction in inflammation and reduction in oxidative stress. Chronic inflammation accelerates aging. As we age, we have more inflammation. So this reduces the damage that happens because of the inflammation on the tissues and the organs, contributing to conditions such as cardiovascular disease, diabetes, and cancer. GLP receptor lower the inflammation, such as C-reactive protein and interleukin-1, and potentially slowing the aging process by reducing the oxidative stress, the stress that comes from oxygen radicals being formed and damaging your cells and your organs. And plus, there's another important thing, which is called calorie restriction mimicry. You may have read the studies or come across studies where there was substantial evidence found in animal studies that calorie restriction extends lifespan. So people who consume less calories, they're likely to live longer. Now, these medications are helping us consume less calories. Less calorie by reducing our appetite, by promoting weight loss, actually making us make better decisions about our health, which may downstream affect on longevity by improving the metabolic health, reducing inflammation, and protecting age-related oxidative damage to our organs and cells. Also, insulin sensitivity, we already talked about that on that benefit of your blood vessels. This insulin sensitivity also benefits your brain. That are few things that are impacting human body in a much positive way when it comes to these medications. Of course, medications are not without side effects. We know their GI side effects, their pancreatitis risk, gastroparesis, nausea, vomiting, diarrhea. There's a risk of thyroid cancer, which has been studied, not thankfully so seen in clinical practice, and accessibility and cost is still an issue. But I wanted to bring it out, this information to you, because I do love the topic of longevity and anti-aging, and I am going to continue to bring more information for you on this channel, Youthful Medicine. So if you like this channel, please subscribe it, like this video so other people can find it. And also, I would like to say, stay healthy, stay youthful. I'll see you in the next video.